So legislatively, pulmonary fibrosis has been an issue on Capitol Hill and in the districts and in the states for 2 decades. So the question is, why is it that we haven't made as much progress as most people would like to see, and maybe as other diseases like breast cancer and AIDS and other conditions where people have really advocated and made a huge impact in a relatively small amount of time? And why haven't we made that level of progress in pulmonary fibrosis? So it's complicated, but I think one of the reasons is that the disease is deadly. And those diseases in the early days were also always deadly. In pulmonary fibrosis, patients and families are so, I think in some ways, paralyzed by the disease because it's usually quick onset. The patients often escalate very rapidly. The condition deteriorates rapidly. And unfortunately, people don't live as long as we want them to with the disease. A lot of patients die within a couple of years. Well, you're dealing still with understanding the disease, coping with the issues, understanding what your treatment choices are, if transplant's an option, navigating that system. And honestly, it takes everything they've got. And also when people have a difficult time breathing, it's not easy to go to Capitol Hill. It's not easy to go meet with anyone, much less a member of Congress and their staff. That's part of the issue. The other is that the disease has not been very well known. So raising the level of awareness of the disease is really key. And I think that's been done, and it's been done for 20 years or so now, which is great. But unfortunately, when the voices rise and then a patient is lost, a lot of times the families don't continue to be involved. So having family members especially and caregivers stay involved even long after a patient may not be able to do that anymore is really the key. And so over the years, over the last 10 years especially, there's been a lot of progress. So we learned how to navigate on Capitol Hill. There was a member of Congress from Georgia, a man named Charlie Norwood, who actually was stricken with pulmonary fibrosis. And he basically showed us the ropes on the Hill. Where are areas that we need to be involved and where are areas where there might be opportunity to increase research dollars and to increase awareness of the disease. And then after he was transplanted for the disease, within about 1.5 years, he passed away, unfortunately. So we lost a huge advocate and ally in Congress. The former governor of Utah, a woman named Olene Walker, also had pulmonary fibrosis. We worked on Capitol Hill together for years. She was a fantastic advocate. She helped raise the level of awareness. She helped us navigate areas in looking for alternative funding, not just looking at NIH funding, but looking at other areas. And because of that work, there's now funding that's provided by the Department of Defense in pulmonary fibrosis. It's in the tens of millions. So it was an increase that was pretty dramatic. The only issue is with that type of funding, it has to be renewed every year. So it takes an ongoing voice. Everyone's voice is important, and we need consistency. So if you're involved, stay involved. Stay involved and get involved, get others involved, and the better that we can do a good job of doing that, of growing this audience, of growing this team of people that are actually fighting and their voices rising, the better we're going to do.